Out of all of the specialties that I could have pursued after finishing medical school, why did I choose to be an ophthalmologist? Why did I choose to dedicate the rest of my life to an organ smaller than the size of a grape, the human eye? Today, I'm going to take you back to the day the decision was made, to the moment that would then change the rest of my life. My name is Saad, I'm an ophthalmologist training in the UK. If you're a medical student or a junior doctor, you know the feeling. You spend years rotating through different medical specialties while you're in medical school, trying to figure out where you belong. Some people know from day one of med school. I did not. When I first started university, I wasn't really sure what I would end up in, although I did have one rule, and that rule was that whenever I rotated through any subspecialty, let's say it was cardiology, ENT, general surgery, orthopaedics, I would fully immerse into it. I would wear that specialty's white coat as if it was my own. And this was not just to get good grades, but truly understand if the work and life associated with that particular specialty was for me or not. And so it was not up until the third year of my medical university that I first had my exposure to the field of ophthalmology. Now, we had a teaching lead obviously during this particular ophthalmology rotation as well. He was sharp, he was really knowledgeable, a very good clinician, and he was not easy to impress. But if you did genuinely give it your all, made sure that you took responsibility for your work in that rotation, my teaching lead would open doors for you. He would open learning opportunities for you. And it was in that environment that I started seeing ophthalmology for what it really was, and it just clicked. Now, since childhood, I have loved doing things which involved using my hands. I taught myself how to play the guitar as a teenager. I learned to also touch Thai professionally, just for fun. And since childhood, I have been an avid video gamer. I love using my hands to play games. So hand-eye coordination had always fascinated me, and this was something that I absolutely enjoyed doing. But performing surgery on the eye, that was a whole another level. Microscopic structures which were microns thick and as a result required micrometer level of precision. Surgeons working on the structures of the eye, the cornea at the front, the retina at the back, using threads which are thinner than the human hair to suture back your eyelids when they're cut due to a trauma. Every single movement matters when you're operating on the human eye. And what about the stakes? Stakes are massive. You're dealing with the gift of sight. You're dealing with one of our most prized senses and possessions, our eyes, responsible for arguably the one sense we depend on the most. Coming from a South Asian background myself, I had seen the impact of blindness firsthand, and I'm well aware of the burden it has, especially in developing third world and rural communities. A blind child would often never get any sort of education. They're left to beg or be dependent on their families for their survival. On the other hand, if an adult is blind in these circumstances, they end up becoming a burden, not by choice, but by circumstance. And on top of that, sometimes the youngest in the family ends up becoming the carer of then this blind adult, and as a result misses out on their own education. Blindness doesn't just affect one person, it ripples through generations. But here's the thing though, many of these causes for blindness are preventable, treatable, and even curable. And that's where eye surgeons come in. Now, coming back to that rotation in ophthalmology in medical uni, I was fortunate enough, thanks to my trainers and because of my clinical lead, I got the chance to assist in a cataract surgery, a procedure which is so delicate that the surgeon needs to use a microscope to operate, and they're working with instruments to operate on ocular tissue which is thinner than the human eye can ever perceive. One of the important structures that we are trained not to cut through is only 3 microns thick. Microns, you ask? For perspective, that's 40 times thinner than the thickness of the human hair. That's right, not twice, not thrice, 40 times thinner than the human hair. So I got the chance to assist in this surgery, and after the surgery we went on the post-op round to see the patients that we had operated on. And so when we came across to one of the elderly patients in the round who had not seen clearly for quite some time now, he was asked by my consultant to take off the coverings over his eye and try and read the fingers held out in front of him. And as my consultant did so, our patient burst into tears. He was overwhelmed with the joy of being able to see something that he was deprived of for many years. And now, thanks to this cataract surgery, he was able to see again. And as he held my consultant's hands to thank him, I could not help but be moved by the impact that this one surgery had on the life of this patient. To this day, I still remember walking home that day, and every step I took, there was one thought on my mind: this is it. I remember telling myself, this is the kind of change I wanted to pursue going forward. This is the kind of work that I would be really honored and proud to do every single day. And from that moment on, ophthalmology had a place in my heart. But remember, I'm still in third year. I have 2 more years to go and a few more specialties to work in. And so I still remained open-minded, sticking to my initial mantra of wearing the white coat of whatever specialty I was rotating in. And I kept doing that for the next couple of years and comparing every experience to each other, trying and seeing if this was something that would make me want to change my mind about pursuing ophthalmology. And so by the end of medical university, nothing else made me feel the way ophthalmology did. So by the end of medical university, my decision was clear. I was going to try and become an eye surgeon. That was the easy part. Now the difficult part was actually getting into training, because that's where most of the difficulty is. Ophthalmology is an immensely competitive field, and so application to it, building your portfolio towards it, is all quite difficult, and rightfully so. It's an excellent specialty with a great work-life balance, excellent and lifelong impact on our patients, beautiful surgery, great mix of medical bits and surgical bits at the same time as well. And how I actually got into ophthalmology here in the UK is a whole another story, one which I have addressed in my previous videos on this channel, so feel free to check those out. But for now, alhamdulillah, I have now performed more than 200 cataract surgeries, which is the same surgery that initially inspired me to start this journey in the first place. And so the more I learn, the more work I do in this field of ophthalmology as an eye surgeon, the more respect I have for this specialty, and the more appreciation I have for the eye surgeons and ophthalmologists who dedicate their lives to this goal. Eye surgeons all around the world are helping patients reclaim their sight so that they can use their vision to see their loved ones, to appreciate all this beauty there is around us in this world. And so that's why I am training to become an eye surgeon with zero regrets, and so glad I've had this opportunity, thanks to my teachers, my mentors, my seniors, everybody who has shown me what ophthalmology is and how it is one of the best specialties in medicine you could ever do. And that's it for today. If you liked this video, go ahead and subscribe to my channel, leave a comment and let me know if there's anything in particular that you would like me to talk about. Also, don't forget to like and share this video with somebody who you think could benefit from listening to the perspective of someone who chose to become an eye surgeon. And as always, you will also find my videos here and on the rest of my channel, and I will see you in the next video.